Sympathetic nervous system. The sympathetic nervous system is the division of the autonomic nervous system commonly known as fight or flight. It acts to prepare the body to react to the stress or injury. This animation will visualize how the sympathetic nervous system controls the heart. There are two neurons involved in sympathetic nervous system pathways, and they synapse at the ganglions in the sympathetic chain. These are the preganglionic neuron, which means before the ganglion, and the postganglionic neuron means after the ganglion. The sympathetic chain is the series of sympathetic ganglia that extend from the cranial base to the coccyx, also known as the sympathetic trunks or paravertebral ganglia. The preganglionic neurons in the sympathetic nervous system originate from spinal cord level T1 to L2, specifically the lateral horn of the grey matter. Hence, sympathetic outflow is often referred to as thoracolumbar. Because the sympathetic ganglia are located close to the spinal cord, the preganglionic sympathetic neuron is relatively short compared to the postganglionic sympathetic neuron that extends to the target organ. Another important difference between the pre- and postganglionic neurons is that the preganglionic neuron is myelinated, whereas the postganglionic neuron is not. For the distribution pathway of the heart, the preganglionic neurons originate in the spinal cord at T1 to T4. They synapse in the sympathetic chain at the same level as the spinal cord origin. The preganglionic neuron then releases acetylcholine, which acts on nicotinic receptors of the postganglionic neuron. The postganglionic neuron then releases noradrenaline that acts on beta receptors of the heart. This causes an increase in heart rate and contractility.